Morning. Welcome back to Age Well. I'm Dr. Maximilian Fuentes Furman. Thank you so much to all of you that were watching the other broadcasts about what is aging and how does aging happen. Today, I'm very pleased to have my first guest. I'm going to try to have a guest on the show every month. James Houston is going to talk about Chinese medicine. I met James Houston a little bit more than a year and a half ago. He was in an office that I always wanted to be in. It was just so fortuitous that he was there. And so one of the things I've learned a lot from older adults is being open to opportunity. If you want something, you don't give up on it. Again, a little bit about James Houston. And I also want to remind you that you can continue to see this on Facebook, YouTube, Spotify, iTunes, and Instagram. James Houston is not from Houston. He's actually from Portland, Oregon, and he's licensed by the state of California as an acupuncturist, and I always spell that wrong with two C's. He's also an herbalist, and an alternative word that I think sounds funkier is herbologist. He's also nationally certified in acupuncture, and he'll talk about a little bit maybe the differences of the national recognition and the state. Prior to this, he had worked as a surgical technician, so you see, again, the practicing of doing things is so different than the kinds of things that I do, where he actually is interacting with the human body, physically interacting. And he was telling me when he worked as a surgical tech, that's like taking things out of people, and now he's actually putting things into people, as in like needles. Practiced as a surgical technician for 11 years in the greater Los Angeles area, and then practiced after that Chinese medicine, which he's going to talk a lot about today. He had completed an internship where he said he had to work 6 days a week and see up to 60 people a day. Wow. At Guang'an Hospital in Beijing. Imagine going to another country and studying there. I mean, that to me is just really impressive. You know, I live 150 miles from where I grew up. I did all three of my degrees from USC. I'm not a person, I guess, who travels very much. And certainly being in a totally different country, different language, different culture, and then having to learn on top of that, very, very impressive. He has been in practice in Westlake Village, California, right on the border of Los Angeles and Ventura counties for many years. He also has Saturday hours and works 3 days during the week. And most insurances will cover some of what he does. We're still working on having Medicare do that. It's one of the things that I lobby for a lot as a gerontologist is in a lot of these, quote, alternative practices like acupressure, teaching people how to do yoga, qigong, we're going to talk a lot about that today, and acupuncture, that a lot of older adults that you have Medicare, I know that it would make more sense you would try this if it would be paid for. So this is a practice essentially he's going to talk about. It's been around for 2,500 years. So again, we are so youth-oriented here, and we tend to look down on things that are older. This hopefully is one of the things that we'll say, even though Dr. Houston has 26 years of experience, that's nothing like 2,500 years of history, as well as adding this, we could say, to what we know of the human body. So welcome to my show.
Thank you, Max. I'm very excited to be here. I'm a great fan of the show. I've been watching it.
Oh, well, thank you.
Your wisdom you bring is very beneficial. So thank you so much for doing this.
You're welcome.
Yeah.
So what are we going to talk about today?
Well, I thought maybe we'd talk a little bit about Chinese medicine, and Chinese medicine specifically around aging or going through time in the bodies that we have. I was thinking how in some ways that we're like on this boat in a river, and we're moving along, and if we were looking on the banks of the river, we'd say, there's my third grade teacher, there's my Stingray bike, there's my first marriage.
You know what Stingray bikes are, right? That's dating us. It's like bikes from the 60s, right, and the 70s. It also was a car, right? A Stingray car,
exactly.
Yes. Okay.
Yeah. So 1967 or 66 probably would be my preferred year of that car.
Okay.
So we're in this boat and we're going along the river, and these times of our life are going past us. And it's easy to get distracted into the experience day to day of what's going on and not pay attention to the boat we're in.
Yeah,
And,
a lot of people
right?
focus on that nowadays. They're really trying to focus
Yes.
of what's happening right now.
So that boat we could think of also as our body, right?
Mm-hmm.
And if that was springing leaks and it was starting to sink, we'd probably jump to and pay some attention to it.
We would hope so.
Yes. But if we paid some attention to it proactively and maintained that boat, I think that could help us in our experience as we move down this river of life, having these human experiences. So Chinese medicine speaks very strongly to that idea.
And being mindful of what's going on with the body. You know, when you're young, you don't pay much attention to that,
Yeah,
right? And you say,
that's
well, the boat
exactly
has
right.
leaks, never mind, I'm having too much fun. Then
That's
you get
right.
older, it's like, I better pay attention.
And we tend to repair quicker when we're younger too, right?
Yes.
So
Life's not fair.
life is not fair.
Mm-mm.
So, I'm very passionate about Chinese medicine. It's a great deal of how I view life. Chinese medicine is a way to orient ourselves like a compass in how to find balance in our life, and maybe how to keep the boat in its best shape.
Mm-hmm.
So the entry point of Chinese medicine is this idea of yin and yang. And yin and yang is graphically represented by the symbol called the Taiji
Yeah, I think
symbol.
we have a picture to show you of that. And when I was growing up, they used to call it yin yang. And I'm hearing today that that's very inappropriate. So you're learning here, maybe for the first time, the correct way to say it is.
Yin and yang.
Okay.
Yes. So the yin and yang is a simple but very elegant way to represent the human experience. And as I said, it's a way to orient ourselves in our life in a lot of ways. So the oldest text in Chinese medicine says that yin is the shady side of the mountain and yang is the sunny side of the mountain. So here we see the poeticism of China and represented in Chinese medicine. So there's these qualities in yin, which are dark, maybe steady, not much movement, quiet, whereas yang has movement and heat and liveliness
So
to
you need
it.
to have both, it
And
sounds like.
you need to have both. That's exactly right. So we can look at our lives in terms of that, and we can say, am I overactive for what my body can sustain, for what my spirit wants to sustain, or am I underactive?
And we know that's an issue. I touched on that in one of my earlier broadcasts, that people don't want to age, so they're, quote, overactive. They're pushing themselves to do things like they did when they were younger. You know, they used to jog 5 miles, so they should still do that in their 60s or even 70s, or the opposite, that, people sit.
That's exactly right. And there's a saying that comes from Chinese medicine that says, if anything becomes too yin or too yang, it turns into its opposite. So, for instance, someone's out jogging and maybe they're not fit enough to be doing that jogging, and then they fall down, they break a hip, and all of a sudden they're very yin because they're stuck in bed with a broken hip.
And this wisdom is how old again?
2,500 years.
Oh,
It actually goes much back much later, almost 8,000 years, but really in a comprehensive way for 2,500 years.
See, this is one of these things that we can consider like new edgy ideas, right?
Yes.
So something becomes its opposite.
Something becomes
if
its
it's
opposite.
too extreme.
That's exactly right.
Okay.
And so we can see, from this 2,500 years of wisdom, that's really been chronicled very well over that 2,500 years. And that's some of how we know that this medicine works, is because it's been so well documented through time.
Okay, so any of you out there that have anything with this symbol, the yin-yang symbol, that's what you're showing is balance.
That's right.
correct? And
That's
and
exactly
the need
right.
of the body for balance
Yes, definitely.
and the mind.
And the mind. And so the idea, the circle around the yin and yang symbol is like the ecosystem of our life. So
What do you mean by ecosystem?
so our body has a state of balance ultimately. And our body in many ways is very forgiving, right? It'll put up with,
Especially when we're younger.
especially when we're younger. It might put up with 4 cups of coffee or not getting enough sleep, but eventually it starts to wear on us, right?
I was thinking about, like, I was watching people on these, like, rental scooters they have outside the studio here. They don't have helmets, and the body's very forgiving. They're going over, like, uneven pavement. And I doubt that people our age, we're so old, we're both in our 60s,
Yeah.
would do that.
Yeah, there's a
'Cause
little.
we would know our body was not be that forgiving.
That's right. We're
Okay.
a little more risk averse, and appropriately so.
Well, appropriately so. That's the
Yeah,
point. Okay.
Yeah. So this ecosystem, this state of balance that we look at in Chinese medicine is, as I said, both about the ecosystem of our body, as well as our lives, and how we do things, what our relationships are,
Okay.
the choices we make in terms of how we relate to life. We could see maybe, say, someone's kidneys aren't doing so well, and there's you can think of it kind of like a screen in the kidneys, right? And that screen, as the blood is purified, the proteins which are valuable to us and we need are brought back into the body, but the metabolic products that aren't helpful for us are let out. So
Okay.
maybe at a certain point, that screen gets a little too big. It's not so good at filtering.
Or it gets kind of clogged up.
Yeah, it can get clogged up, or it can be so that the screen gets bigger and the proteins are dropping down and go out into the urine and go
Okay,
away.
so kind of like a screen where you're trying to, like, keep things out of your house.
That's
and
exactly
as
right.
it ages, right,
It
that
gets a little bit bigger,
and so
right.
things get in that are not supposed to get in.
That's exactly right.
Okay.
And so then once we start spilling those proteins, we're not able to really clear metabolites so well. Then the balance of that ecosystem starts to go off. We start getting into kidney disease and ultimately kidney failure. So not only from an Eastern point of view, but from a Western point of view, we can see the balance and interdependence of the elements of our body and the functioning of its physiology.
And the awareness, right, of
and the
aging
awareness.
and
That's
how
right.
it changes.
That's
what we can
exactly
do.
right. Yes.
Yes.
And so, you know, as we get older, it's never too young to start, but as we get older especially, doing things that support our body and support our mind, and beginning to discard maybe some of the things that we would have done in our youth.
And as we touched on in a previous show, just having this information so that you know
That's
what
right.
you can do.
That's
instead
right.
of not really knowing, thinking the body just ages, it breaks down. But specifically, we're hearing something about the kidneys now and how they change
That's right.
in everybody.
In everybody.
Even
Yes.
here in Hollywood, they
Yes.
do. Yes, they do.
And you know, someone may have stronger kidneys than another person, but perhaps they've got something else that isn't working so well anymore, you know? But
So
rather,
that's about the ecosystem. You're talking
That-
about the balancing
that's exactly
of how
right.
things go on in the body.
that's exactly right.
Okay.
So there's things that we can do then to help strengthen and help balance these functions. There's a term in Chinese medicine which is qi, and
Can you spell that for us?
well, it's in Chinese, but if we were going to say it in pinyin, which
What's
is it's a
pinyin?
transliteration of Chinese characters.
Okay.
So it would be QI.
Okay.
Sometimes you'll see it in another form called Wade Giles, which is CHI. Chi.
Okay. So qi, QI or CHI.
That's exactly right.
For us English speakers, right? I'm
Yes.
so impressed always that someone can learn such a very different language.
We have this energy, this qi that runs in our body. That's one of the foundational ideas in Chinese medicine and in Chinese culture. And it runs in these vessels, just like blood runs in blood vessels. Now, if we do surgery, we obviously don't see those vessels. It's an energetic construct. Maybe someday we'll have some kind of imaging that can actually see them. But right now we don't. So the idea is that these vessels, some of them run close to the surface of the skin, and that's where acupuncture points are. And then they'll dive deep and connect with structures or internal organs. And that's why a point on the leg maybe can help with a stomach ulcer, because you can access
so
it there.
The stomach is connected to the leg.
So the stomach is connected to the leg. Yes, it's arcane but well mapped out, right? So that's some of the interesting qualities of Chinese medicine.
And so translating that term, qi, how would you translate that in English?
I would translate that into energy. So
it could be bad energy as well as good energy?
We don't so much think about it in that way.
Okay. So you can see my Western questions here, right?
More like the idea would be, oh, I'm tired all the time.
Okay. So you don't have enough qi.
So you don't have enough qi. That's qi deficiency, right?
Okay.
If we're stuck on the 405 freeway and we've got to be somewhere.
That's a terrible freeway here.
That's a
Los Angeles
terrible
area.
freeway.
More like a parking lot.
Yes. We've got somewhere to be and we're stuck on the freeway and we're starting to get anxious about that or irritable about that. Maybe that would be a symptom of stuck qi or stagnant qi.
Okay.
Right, and then that has a kind of effect on our neurophysiology, our neurobiology, that we start getting ramped up, we start getting a little bit more anxious.
So kind of like a client last night who was so surprised at all this anger that came out of her. She had this stuck qi, right?
Yes,
and all of a sudden
exactly
it got unstuck.
Right. That's exactly right.
Okay.
Or in a case where someone's getting anxious, you might have them focus on their breath or have techniques that begin to moderate that anxiety. And so from a Chinese medicine point of view, what that's doing is it's beginning to move that energy.
So can you comment on one of the hallmarks of aging, sad to say, is not having the energy that
that's exactly
one
right.
once had?
Yes.
How do they talk about that in Chinese medicine? The depletion of qi as you get older.
So you know, I don't know about now. China's very modern, but the first time that I was in China and we were still riding bicycles around, you'd go to the parks and see the elderly people doing Tai Chi.
And there's the qi word again, right?
Right. Being actively engaged, and so doing these exercises that cultivated or increased these energetic qualities. So on the one hand, they're reserving or preserving their qi. They're not out running around beyond their capacity, and they're actively cultivating qi and building it within their body.
So potentially you're replenishing it, like we talked about a car that never runs, right? It will stop running because you're not charging the battery.
That's exactly
so as
right.
an older person, when you're doing these kinds of exercises, you may see a brief video at the end of this program, I think, on Tai Chi.
Yeah, exactly.
And here in Southern California, and likely many other parts of the country, you can take classes sometimes for free.
Yes.
In Tai Chi.
Yes.
So you're talking about seeing all these older people doing these exercises as a group.
Yes, and then coming back to the States and seeing people with walkers and in assisted care, and it was such a big dichotomy, and it is really a lifestyle difference.
Or even an expectation, right? If you're expecting
That's
that
right.
as you get older, you use a cane or a walker, or that where I live, people drive to the mailbox, they fight over parking spaces outside the gym. You're talking about riding bicycles everywhere to just commute. It's a totally different expectation
Completely
of
different.
how you're going to be as you
That's
get
right.
older.
That's
so
absolutely
that's
right.
qi. And so now we're going to then talk about how that is part of acupuncture.
Yes, and also just another thing to add is the quality of food we eat is another aspect. Like you mentioned the metaphor of the car with the battery, but also the gasoline that you put in the car as
You
well.
are what you eat, is
You
what
are
my
what you
grandmother,
eat.
who was born in the 19th century, used to
Yes.
say.
Yes.
So this is also
So-
part of Chinese medicine.
So this is part of Chinese medicine too, Chinese dietary therapy.
I shouldn't have had that ice cream last night, I guess. Huh?
Well, maybe a little bit.
Okay.
So how this energy runs in our body affects how efficiently our organ systems operate.
Okay.
It affects how deeply we sleep, how easy it is to go to sleep, which is a very common problem as we get older.
Yeah, some of the stores I notice now, just like the drugstores, have sections, huge sections, over-the-counter sleeping aids.
That's right.
I don't remember seeing that when we were kids.
No, I don't
So
think
people
that was
now have
there.
more trouble, ramping their energy down.
Yeah, it's that's again in Chinese medicine. That's not exactly the way it's viewed, but
Okay, so how would
somewhat.
it be viewed?
So in Chinese medicine, because it's so old, we talk.
So
It's so old, even older than me. Um, the organ systems and what we say they do. Sometimes they add up with Western medicine, and sometimes they don't.
mm-hmm.
And so, in Chinese medicine, there's the liver is does more things than we say it does in Western medicine, and we have to use this traditional sort of structure of Chinese medicine in order to get it to work. We have to kind of set Western medicine a little bit aside for a moment, and so within that. We have these substances, like I talked about, yin and yang, and one of those is blood, which is a yin substance.
Okay.
And there's a relationship between qi and blood in Chinese medicine.
And you're
and
talking
they-
about just setting aside kind of like Western medicine. I think a lot of viewers are willing to do that.
Okay,
If they're
fantastic.
in pain and they're suffering and they've sought all these specialists and things and they haven't helped them. So I wouldn't think that's necessarily a bad thing. So again, part of
It's-
getting older, right, is you're more adaptive and flexible. You're willing to say, like, I'm going to try something different.
That's exactly right.
Okay.
And again, it's within the philosophy of Chinese medicine. You could
Mhm.
say that we're applying this. We don't know biologically all of how it does what it does.
I don't think we understand biologically a lot of things.
That's true.
You know, so often, certainly in my field, in the brain, they're always saying, like, they think they know things and they say, oh, we don't understand that.
So this liver blood, in any case, which is a byproduct of qi,
Okay.
when that's strong and rich, it helps to root the yang at night. So it's very poetic.
Yes.
As I said before, yang is activity, right?
Yeah.
And heat and light, and yin is quiet and settled. So
Okay.
when our yin is in balance with our yang, the yang at night is able to sort of rest in the yin, and we're able to just kind of drift off into a nice and deep sleep and wake up with an appropriate amount of energy.
Yeah, I'd like to know
and,
how many of the viewers have done that recently.
Yes, right?
Because I'm often struck by, even in, quote, younger people, I ask them in my trainings, raise your hand if you had a good night's sleep last night. Probably 5% of the audience raises their
Wow.
hand. That's all.
Yeah.
And that's so common. And I think older people, we've touched on this a little bit in the previous show, you don't sleep the same way as you did when you're younger.
That's right.
And so people take a lot of medications to try to go back to that, and then they have side effects from that. So moving on, we're going to talk about then what acupuncture is.
So acupuncture, there's areas on the body called acupuncture points that connect with these vessels that hold the qi.
And we have a picture of this, I
And
think.
we do have a picture of this. And so there's roughly about 400 points in the main.
That many. Even a little person like me, there's 400
Yes,
points.
even
Wow.
in
They must just
you.
be closer
That's
together, though,
right.
I think. Right, okay. Okay.
So there's about 400 points, and there's actually many more than that, but these are within the main.
There's many more than that.
Yes.
And how did
there's,
they figure out all these points?
And that's a great mystery, right?
Oh, the mystery, okay.
So, perhaps they found rubbing areas help them in certain ways, but there's very rudimentary acupuncture needles made out of even stones going back a long, long time. And so,
And what I like about that story is it tells me, see, the human body hasn't changed
that's
in
right.
2,500 years,
That's
right?
right.
We maybe have different technique, like than stones, because
Right.
I don't think you use stones
Yes,
anymore.
it's called beyond.
But same idea,
Yes.
same points.
Yes.
Yeah, same points.
And so these points, over time, they've mapped out functions,
Okay.
So maybe a point right here will help with a headache or relieve inflammation. Another point will do other things.
So I think some of our viewers though are skittish about needles and like having things stuck into them. Can you explain what that could be like? Like if you were going to put a needle like into my hand here to alleviate some pain. So I'm having pain to lessen pain.
Yes, so I can speak to how I do it.
Okay.
Okay, and there's better and lesser quality acupuncture needles, and so I use the best quality acupuncture needles, and
Meaning that then they don't hurt as much.
they don't hurt as much.
Okay.
Right? So you want to find an acupuncturist that is willing to shell out a few bucks for good equipment.
Okay.
Yes. And the second is the skill with putting them in, and that's something that I worked very hard on, and I hope that all practitioners of Chinese medicine pay attention to that.
Now, personally, I can speak to it's like one of the things that I do as a giving person is donate blood, and you're probably aware if you do that, or even if you have blood taken, some people are much better at you don't feel anything, even though they're putting a much larger needle in. When I've actually had acupuncture from Dr. Houston, it's like you don't feel anything. You can see that it, for him, is almost like a reflex of just putting it in.
And I could probably put 6 acupuncture needles in the hole of the needle that you're getting blood drawn with. So they're actually
Yeah,
very
they're little
small.
tiny needles,
Yes.
yes.
And so, there's several different ways to put together an acupuncture prescription. But you put the acupuncture needles in a certain order, leave them a certain length of time, maybe stimulate them in a particular way.
And about how long a period of time could it be?
Anywhere from 20 minutes to maybe 40 minutes, something like that.
Okay. And in his office, it's very quiet and dark, and we have this great music, because I share an office with him actually, playing that relaxes you. And so a lot of people, I think their experience is they're not even aware that they have anything inserted inside into their skin. They go to sleep. It's a very relaxing
It's very
kind of
relaxing.
mindset, yes.
Yeah. It's kind of like a 20-minute vacation, really.
Yes. And so is this something then that gets repeated? Like a person goes more than one time for a treatment?
My ideal is, say a person comes to me with a particular problem, and we resolve that problem.
Like if they had an injury from falling with their back,
Yeah, say
and
for
maybe
instance.
more traditional things have not helped, like physical therapy,
Yes,
or
exactly.
even injections of an anti-inflammatory, and the physicians have said you need surgery, and the people are very skittish, they don't want to have that done, so they're willing to try acupuncture. About how many treatments might they have for something like that?
It's very dependent on what's actually going on with them.
Okay.
It might be 3 treatments, or if they have a large disc bulge, there might be more maintenance.
Okay, so you would actually look at some of the issues ahead of time, like from scans that they've had, and
Yeah,
go
so
over
if
with them
anyone
the treatment.
has an MRI, we look at that, and that gives us information. But
Okay.
clinically, we also have probably a sense of what's going on.
And one of the things I've been impressed with Dr. Houston that I think is important when you're older in particular is he takes time to take a history from you. The body holds its history. A doctor once taught me that. And that you
Yes.
sit down and really ask, like, have you ever injured your hip like when you were younger? And people will say, oh yes, I fell off my bicycle or my motorcycle or whatever.
Yes.
It's not just recently that they have something.
Yeah,
You
that's
take
right.
all that into consideration.
That's right. So my ideal is to resolve things, and then if I could see someone maybe every 4 weeks or 6 weeks and maintain them,
Okay.
it's easier to keep something well than to fix it when it's broken.
Well, that's an astute thing to say. And then I know the other thing that you provide is herbs
Yes.
to people.
Yes.
So can you talk a little about being, I said two things, an herbalist and herbologist?
Yes. I suppose it's tomato.
Yeah, same
But,
thing.
Chinese herbology is fascinating. It's very complex. It's got a very systematic system of or framework of working with the herbs, a logic to it.
So if I was this person again with this back pain that was so bad in the morning in particular, you know, you can feel like the Tin Man from Wizard of Oz, you know, you can hardly move and, you know, you're wondering what's happening to me. My client yesterday was saying someone's going to have to take care of me. This is terrible. And she had moved a 30-pound pot in her backyard.
Yes.
That was what she did. She's 80 years old. She's like, maybe I shouldn't do that anymore.
Yes.
Can you just kind of touch on lightly the idea then of how you might augment or add to acupuncture with herbology for somebody like that?
Okay. So for somebody like that, I'd probably give them one acupuncture treatment and they'd be all better.
Really?
So
Wow.
so let's take something else like maybe the insomnia or an allergy. The Chinese herb formula is constructed from anywhere from 4 to 12 herbs.
4 to 12 herbs.
Yes,
Okay.
exactly. And so we know what these herbs do, what the effect in the body is, and there's a theoretical framework for putting that together.
Okay.
So first we diagnose them from a Chinese medicine point of view, and it might be something like the liver blood deficiency.
So that could be a contributor to their insomnia.
That's exactly right. So
Okay.
that the yang is not resting in the yin, right?
Okay.
So then we are going to use primarily yin tonifying herbs,
Mm-hmm.
maybe some herbs that kind of settle the heart, settle anxiety a little bit, even something that's more calming.
So are these herbs something that people would take on an ongoing basis, or they take it until the problem has dissipated?
So the herbs are tracked through time, and their formulas might change even as we go through correcting the imbalance that's going on.
Okay.
After that, the herbs might be transferred into something that's more ongoingly helpful and supported for them, but maybe not as much for the original problem that they came with.
Okay. And given that neither one of us are physicians, it's important if you are on herbs or being prescribed herbs that you always run that by your primary care physician or your physicians if you're given other medication to make sure there's not an interaction.
Yes, and most Chinese medicine doctors are actually trained in herb-drug interactions and are familiar with the types of herbs that shouldn't be given with certain types of medications. But there is a distinction you're making here between just going and seeing some guy at an herb store and seeing someone who's licensed and well trained
so that makes a
in
big
medicinal
difference.
herbology.
Right. And knowing about Chinese medicine.
That's exactly right.
Yeah.
And we're lucky because California has a very strong education and licensure system. So I think people are in good hands, generally speaking, with a licensed Chinese medicine doctor.
Yeah, because I think that when people are in pain, they often are desperate in my experience.
That's
And
right.
so they'll go into like a health food store and, you know, the clerk in there that is not trained in Chinese medicine
That's
will
an
recommend,
excellent point.
or like in even a grocery store, like some of these larger chains that I can name drop, you know, like Whole Foods or Sprouts or stores like that, they can have a huge amount of herbs in there. And there's no one really that has your background to really vet for the person. Is this appropriate to take with your blood pressure medicine or your blood thinner or your pain medication? So this is another thing that we're kind of educating you about as your body becomes, in my opinion, far more fragile as you get older in terms of the things that you're putting in it. So when you go to someone that has your background and training,
That's right.
that's the person to go to if you're interested in augmenting your treatment or having your treatment be about herbs. So we'll make sure that we have time to talk about Qigong,
Yes, so
which is that Qi word again,
that
right?
Qi word
Qi
again.
is there in Tai Chi and Qigong.
Tai Chi and Qigong. So, you know, I mentioned about the elderly people doing Tai Chi in the park, right? And so we have a little video of the Tai Chi here, and you can see beautiful 24 form being performed in the park, actually in Beijing, in this clip. And so
What's 24?
the 24 form is probably the simplest Tai Chi form. There's different.
We're all for starting out simple. Correct.
Yes, yes, but yet very therapeutic, very effective, very easy to learn, and as we move through this beautiful flowing exercise that Tai Chi is, it strengthens our bones, it strengthens our ligaments. There's been many studies that have shown the importance of balance that it adds as we get older, because balance is a major issue.
Yeah, and that's what's interesting in some of these studies about Western versus Eastern, or places like Los Angeles where we drive to the mailbox, that you don't see these balance issues in a lot of Eastern countries, or even out of impoverished countries where people don't have transportation, so they walk everywhere. I think you had the statistics, a senior dies from falling every 29 minutes.
That's right. Isn't that an
Not
amazing
just falls,
statistic?
but dies from falling.
From falling.
And it's that darn gravity. I always say, right, as you get older, you should have like less gravity, so we kind of float away. Yes, I know at least now 10 years ago, it was down the street here at UCLA, found that just 1 week of doing Tai Chi, like once a week for 6 weeks, significantly decreased the fall risk of an older person. Because I touched on in my previous training here about reaction time.
Yes.
And when you get older, you just don't have the reaction time.
That's right.
So you go to fall, and if you have very poor balance, you're just going to fall like a bag of cement.
Yeah.
So in the Tai Chi, as you see in the video, you really can see the movement, the flexibility, the ability of someone worth falling, right, to kind of catch themselves.
That's exactly right.
So we're going to show the video?
Yeah, I think we saw that already.
Oh, we did? Okay.
Yeah. So, so as an offshoot of Tai Chi, we have what's called Qigong. And Qigong will take maybe elements out of the Tai Chi, but might be a simpler exercise that has movement and breath. Sometimes it's static. Sometimes we're just kind of holding a position and doing a particular breath. And it's a way to augment or build Qi within the body. And originally this came from Chinese martial arts, Kung Fu, like the Shaolin monks. And so it's a very tangible representation of that kind of internal energy and power that they've built. Their ability to maybe just throw someone across the room with a short punch, you know. But
yeah, that's something you could work towards as you get older.
That's right. So
well, that might be helpful.
That might be very helpful. Get a lot more respect as we age.
And yes, I have a very good friend. I give a shout out to Kenan Kashima, who teaches Qigong in San Diego, and I took some courses from him. And what I was really struck by was the connection with aging in the body. That some of the exercises specifically seem to work on areas of the body like the shoulders, which as you get older you can have a lot of issues with flexibility and movement. And it was like these wise folks kind of figured this out, that these were areas that needed kind of a little bit of tender loving care. 2,500 or whatever years ago, the body needed that. So this is another alternative practice. We're talking a lot today about going like to Dr. Houston and having acupuncture, herbology, but things that you can also do on your own or through classes, Tai Chi, Qigong, available like locally here in senior centers. If you're watching Facebook and YouTube, that you have that on there. And just doing a little bit of it can make a huge difference.
Going to a Tai Chi class can change your life and get you away from Netflix or the Oprah show.
You could do it while you're watching Netflix, potentially, right?
You could, exactly. Yeah.
Yes, right. So you said coming back to the yin and yang.
Yes. So you know, say for instance, we talked about Tai Chi. Tai Chi will put you into connection with your body in a particular way. And looking at yin and yang, we can see our life. Are we sleeping enough? Are we eating well? Are we getting outside enough? Are we experiencing friendships and community? It's all about balance. So this is a kind of self-assessment. you know? I think that we all have a kind of awareness that if we put it towards ourselves rather than just going, oh gosh darn, I'm feeling this way or something, we can instead take that as a prompt to do something that benefits us. And then that gives us power, it gives us strength, it gives us more confidence and more equanimity.
So potentially, that's a great word, equanimity. Potentially one of the perks of getting older is that your body is going to talk to you in a way that you're almost more forced to listen.
Yes.
When you're younger, you're suggesting in a way that we maybe could be really out of balance, but not as aware of it, because we're not having the pain, we're maybe not having the side effects of chronic sleep deprivation, we're not falling in the same way. We can trip, but we have the reaction time to catch ourselves. So as we get older, it's kind of like the machine is telling us, like, there's a problem.
Yes.
And then we can do something about it. Because a lot of what this show is about is empowering older adults, that you can use a lot of the things that Dr. Houston's talking about to enhance your life, that it's not all a negative loss thing.
That's right.
How would you say that Chinese medicine views aging?
Chinese medicine views aging as part of the natural process between being born to completing our life, and sees it as a continuum. And it doesn't see it as a disease.
Negative thing. As a disease, yes. Aging is not a disease. Maybe in Western culture, we no longer think that.
Yes.
So they don't think that you can stop it.
There's you. No, you could do plastic surgery, perhaps, but it's a sham. We're still getting older.
Still getting older.
Yeah.
And I think one of the things I most like about sharing an office with Dr. Houston is you can see that in Chinese medicine there's this venerance of older people. He has a lot of calendars and pictures and things that show people with gray hair and wrinkles. So can you talk a little bit about that and kind of how Chinese medicine views wisdom?
Yeah, well, to your point, Chinese medicine and Chinese culture venerates the wisdom that comes through life experience. If you look at someone practicing Chinese medicine, when they first get out of school, they're competent practitioners, but maybe 26 years in, they have a little more clinical experience and a little bit more wisdom that can be helpful for their patients. But that's true for everyone in our life, right? We hopefully gain wisdom and perspective and
well, particularly if it's something that we're still viewing as valid after 2,600 years. I had touched on in one of the previous trainings about the weaving skills of these folks in South America and how important that was in this surgical technique in heart repair. With so many things we don't view that if you knew it, like in the 60s, it has no, riding your Stingray bicycle has no value now, essentially. Or anything that we did years ago has no value. So many of my older clients will say that what they know is not of value. It sounds like if you were around 2,500 years ago, it would still be of value now.
Yes.
Yeah, that's kind of what you're saying. So you had written something on our handout today about support, what is weak?
Yeah, so there's a kind of an encapsulating term to how to view all this subjectively, which is to support what is weak, reduce what is excess, warm what is cold, cool what is hot, move what is stagnant, and rest what moves too fast.
And where does this come from?
And that comes directly from Chinese medicine and directly from the symbol of yin and yang that we started this conversation with.
Would you say that you can do all those things as you get older?
Of course you can.
Well,
Yes.
You say of course, but I believe there's a lot of viewers that believe that after a certain age, they can't get better. Have you ever encountered that in your practice? And my friend always says, when do we stop practicing, we really know what we're doing. That when you encounter it in your practice, that someone actually has the attitude that maybe they're so old you can't help them.
Yes, and you may or may not be able to help them if they have that fixed belief.
Oh, so it's a
Right?
belief. It has nothing to do with their body, right?
Well, things, generally speaking, things can be improved, right? We're all going to get older. We're all going to die at some point, right? Yet we can enhance the what's so of our condition as best we can. We can take any condition and make it worse or improve our experience of it. Even sometimes just by adjusting our perspective on the experience of that condition.
Adjusting our perspective. Right now you get into the kind of things that I work on all the
Right.
time, right? If you have the belief that you're actually too old to try acupuncture, you're 85, you're in chronic pain, you've had an accident, you've had other kinds of chronic health problems, you can see how that would interfere in your willingness to even give this a try.
That's right.
Right?
One of the beauties of Chinese medicine is people don't have to believe in it. It works on dogs. It works on racehorses.
It works on dogs?
Oh, yes.
Really?
Yeah, veterinary acupuncture is huge. Yeah.
So how is that for the doggies? Like,
It's better.
how do you get them to relax, though? I think of
The-
my husky, and how would I get him to
Well,
relax and say, Dr. Hughes is not going to hurt
Mostly,
you?
well, I'm not a veterinary acupuncturist, but mostly, from my experience, dogs just lay down and fall asleep. It's very calming.
Okay.
So the point being that the dog doesn't believe in the acupuncture working, but yet it's still effective. However, that said, I think remaining positive and being open to change, being open to healing, being open to learning new things is always beneficial. It always enhances our quality of life. The more sort of we close down and get tighter, and our joints get tighter, and we're less active, and the less to the quality of our life. So
I'm getting
why
this
not
image
open the
again,
windows,
right?
you
That you're
know?
thinking about a person that's like this, right? And they're all closed up and they're not open to new things. That you can see that even in their body.
That's correct.
Versus somebody who comes in and says, like, I have an open heart, I have an open mind.
That's exactly right.
And as we're wrapping up today, and I want to make sure you've gotten to say everything that you're wanting to say, I so appreciate you coming, taking time out of your life to do this. You also went through this transition from working in Western medicine, being open to
Yeah.
something different. Can you talk a little bit about that?
I think that I loved my time in Western medicine. I think that the quality of help that's given from the surgical teams and the nursing staff, I really view them as heroes. You don't get to see them. You go in and go to sleep and come out, but
Yeah, and they
the-
stand up for
the
8-10
dedication
hours at a
work.
time.
I know we used to
right?
do these brain surgeries, right, and stand up for 10 hours. So
And then you didn't have acupuncture to
and
do
then-
afterwards.
and
right?
then- that's exactly right. So it's kind of like the right and left hand, and really I see it as an integration of Eastern and Western medicine. I see no conflict there. It's about what's appropriate at a particular time, and that I think that gives the best care to
Because
people.
one of the reasons I wanted to have you on the show, and we're going to be having other guests in a similar kind of vein, that you yourself show that as you got older, you did new things,
Yes.
different things, that you weren't just sort of locked into, this is what I know, and this is what I keep doing. And a lot of you may get stuck and say, I don't like what I'm doing anymore, but I'm not open to trying something different.
All right.
We know that the brain enjoys going out of its comfort zone.
Yes.
So even if you tried acupuncture once, like, what's the worst that would happen?
That's
Has
no-
anyone ever like gone out screaming and saying like, "This is horrible! I can't do this! Like, I'm afraid of needles. I can't look." I mean, is
Well,
that
I've
what they
only
do?
been doing it for 26 years, but I've never had that happen with
You've
anyone.
been doing it a quarter
and-
century,
and-
thousands of people, right?
And I always go, well, I've got Montessori kids in my practice, so
What does that mean?
from someone who's very young, maybe 5 years old, 6 years old to someone who's 95 or 96 years old. So,
And no negative side effects, right?
no negative side effects. I think, and I hope everyone has gotten value.
But what I'm getting at is that their willingness to try it once.
Absolutely.
You know, we say, as a psychologist, you always say, like, what's the worst that's going to happen, and what would you do if that happened?
That's
Well, what's
right.
the worst that would happen?
That's right. Maybe they'd relax.
Or that they wouldn't get better.
Yes.
And they're obviously not getting better to begin with,
Right.
correct?
Correct.
But I think that you covered a lot of ground here today in the sense of the importance, as I said, about going to a geriatrician earlier, of going to someone who is trained in Chinese medicine and in acupuncture and certainly in herbology as an herbalist, to not just be open to kind of taking what maybe your neighbor or the clerk in a store, you know, I know we've all been clerks in stores sometimes, but they don't really have that kind of background. So, going to people that you feel could potentially help you, and to be open to trying something for the first time.
Yes.
So your oldest person is like in their 90s?
Hundreds.
Hundreds. Oh my goodness, okay. And so is it different doing acupuncture on somebody in their hundreds?
Yeah, it is different. There's modifications, and you have to be sensitive to their maybe a little bit more delicate. So
Yeah,
yeah.
the skin is a lot thinner, correct?
A little bit difference between doing someone who's maybe 101 and a professional athlete. It's just inherently two different.
But look again to how this could work with each of them.
Absolutely.
Look at the utility of that.
Yeah.
You can't say that about a whole lot of things.
No, you can't.
Correct?
Even their pets, right?
And even their pets, right? Yeah, because I would imagine it's the same principle, correct?
Yes, it is.
Yeah. So as we've been watching again the video of Tai Chi and the value of moving around, because what some of my colleagues say is that aging is not a disease, but the real problem is disuse,
Yes,
and that we just don't move around enough,
that's right.
right? We come home and we're exhausted and we sit, and now we can sit, you're sitting and watching all this stuff instead of
right.
moving around. And I know that around the world, older adults who tend to, quote, age well, are just doing a lot of movement.
Yes,
I know when you were in China, did you see people moving around a lot?
all the time.
Like on their bicycles, right?
On their bicycles, walking, carrying their groceries, doing Tai Chi in the park.
Mm-hmm. When I was in Europe a few years ago, I remember seeing these people on their heavy single-speed bicycles going marketing, and then picking the bicycles up and carrying them into an apartment
Yes.
upstairs with
Yes.
no elevator. This was just normal for them.
Yes.
And here, you know, people fight over places outside of the gym for parking.
Yes.
'Cause
Yes.
they're really struggling with, I can't walk those extra feet, you know, I gotta exercise in the gym.
That's right.
And I think that, like so many changes, we often are not aware of the long-term effects of the choices that we've made.
That's
That
right.
even when we started things with like television or even radio, that's changed how the brain functions.
That's exactly right.
And so nowadays we walk around like this all day, correct?
Yeah.
I saw a woman the other day, must walk in traffic
Yes.
like that, yes.
There's a diagnostic code now for people who get into accidents walking into things with their iPhones.
Really?
Yes.
There's a diagnostic code. Well, there's another term we could use for that, you know, as we can make fun of younger people. I can't imagine that an older adult would do that.
Oh, I think it happens.
Really?
Yes.
No, I would think probably not as much.
Not as
because,
much, I'm
you know,
certain.
that it takes longer to learn something new as you get
Yes.
older, and it is something new.
Yes.
And so you're much more mindful of, like we're talking about, wearing a helmet
Right.
and being more cautious.
Right.
And so it probably would intuitively make sense to you that it's not good to be looking at this while you're driving or walking.
Well, I give you that. Statistically, the younger folk are more prone to this particular diagnosis, you know. But just getting outside, you know, and walking and looking at the trees and not your cell phone and smelling the night blooming jasmine or honeysuckle. It changes our brain. You know, it changes our perspective on life, and it helps our body because we're moving energy, and our muscles are stronger, and so.
Thank you so much for coming today. It's been a
I've
great
enjoyed it
pleasure
so
seeing
much.
you.
Thank you so
And,
much, Max.
Thank you for sharing your wisdom.
Thank you.